My name is Janelle, and I was surprised to learn that I ended up getting 23 for all three leadership characteristics of administrative, interpersonal, and conceptual, ranking me at a high level for each. Personally, I have no interest in being a nurse manager or taking an administrative role. My skills are best utilized at the bedside and in direct care of patients. However, this exercise and results made me think of what I could very well be an effective nurse manager if the results are true to form. With that being said, to secure resources such as staff on my floor, I would certainly employ good communication between other managers and supervisors and current staff, keeping all parties that will be directly involved and working together to acquire the staff that fits well with the whole unit is a must. From my year working on the medical oncology floor, I've learned that teamwork and trust in your coworker is essential for professional patient care and for our own sanity. Our floor is currently short-staffed as a lot of our nurses have left around the same time frame. We are continuously getting float nurses for random nights, and it's been a very jarring experience, which has frustrated the nursing staff to exhaustion. Our management team has since started peer interviews to get our nursing staff involved, which I think is a wonderful way to ensure a potential new hire is a good fit. When determining patient-to-nurse ratio for each shift, our charge nurse contacts the nurse supervisor, who is in control of allocating appropriate number of nurses to each floor. They look at the census and determine how many nurses each floor will need, and our charge nurse will either call off a nurse or attempt to call a nurse in if necessary. The article that I found, The ABC of Healthcare Team Dynamics, Understanding Complex Affective Behavior and Cognitive Dynamics of Professional Teams, is an excellent resource to understanding interpersonal relationships among coworkers. The article states, quote, more than 70% of medical errors are attributable to dysfunctional team dynamics, end quote. Team dynamics play a more important role in safety and care of our patients than most of us think, and it's essential for everyone involved to maintain professional behaviors, while at work. The article notes that the conflict is more likely to happen when groups find differences with each other and similarity with others. Essentially, simple differences, whether it be opinions, beliefs, or outward appearance, lead to conflict, resulting in work-related errors. That just doesn't seem right to me. Personally, I prefer a more vertical hierarchy approach to leadership and management. I like knowing my chain of command and whom I need to go to when I need guidance or help. During the night shift at my work, it's easy to know who's in charge. We have one charge nurse and then our nurse supervisor. During the day, there are multiple clinical nurse leaders, which I have absolutely no idea what they do or what they're in charge of, a charge nurse, multiple nurse supervisors, and a nurse manager that is all present on the floor. I'm so confused with the chain command during the day that when I do end up switching to days eventually, I'm going to be in trouble. So needless to say, I revert back to my main characteristic that I hold true to any workplace, which is communication is the main key to success in any work environment.